Hello and welcome to COVID Conversations here on WNCU-FM. I'm Kimberley Cartwright, host. I'm the News and Public Affairs Director at WNCU 90.7 FM, and we're using the Zoom platform to talk about how COVID-19 is affecting our world. Laboratory testing is playing a critical role to control the COVID-19 pandemic, whether it's by diagnosing patients with the novel coronavirus or screening the general public to determine the full extent of the outbreak. I have as my guest today, Dr. Joseph Plaksin. He's a primary care doctor at Lincoln Community Health Center in Durham, North Carolina. Hello and welcome, doctor.
Hi, thanks for having me.
Oh, it's my good pleasure. And I want to tell everybody how we met for full disclosure. I went to have a test for coronavirus because I was exposed to someone who actively had the virus, and I called to make an appointment at Lincoln Community Health Center, and then I got you, and you did an assessment for me, and that's how we met. You agreed to be a guest on the show. So full disclosure, and thanks for that. So can we talk just a little bit about what kind of infection COVID-19 is?
Sure. So COVID-19, it's a viral infection. It's in a family of viruses called coronaviruses. They call it COVID-19 just because 2019 was the year it was first recognized as a new infection. And coronaviruses are pretty common. Two other ones people might have heard about are SARS, which was an issue in Southeast Asia and more Canada than the US a number of years ago. And then MERS, which is a Middle Eastern respiratory syndrome, which didn't really get over here as much, but that was also around a few years ago.
So can you talk about the disease and how it can affect different people in different kinds of ways? We see different people in different circumstances who are affected by the disease.
Yeah, this has been probably one of the most challenging things of the pandemic is how variable different people, their responses are to it. So some people are completely asymptomatic where they test positive, but they never have any symptoms at all. Other people have very mild symptoms similar to a regular seasonal cold virus. Some are a little bit more severe, more in line with a typical flu virus you'd have. And then unfortunately, there's a group of people who get sicker than that and require hospitalization or even being in the ICU on breathing machines. And that's really what's driving a lot of the death rates and a lot of hospitalizations and problems we're seeing across the world.
So I want to insert maybe prevention to help to prevent all of those possibilities. What should people do?
It's really the basic things. So social distancing, not being around large groups of people, trying to avoid even smaller groups of people who live outside your home because you're never sure where they have been. We've seen a lot of people try to make bubbles where everyone in there is only around each other. But if you really look at that, that breaks down pretty quickly because everyone has a tendency to make exceptions to that. And if someone else in your bubble makes an exception that you're not aware of, you could be putting yourself at risk and not really know it. So that's, I think, the core thing. And then if you are around people outside your home or you are going out to the grocery store, pharmacies, anywhere in public, really wearing a mask, a cloth mask, a surgical mask, anything provides some degree of protection. And then frequent hand hygiene, the kind of the basic things that all the public health organizations have been trying to get across to everyone for almost a year now.
Can we talk about those exceptions outside of the bubble? And I want to make reference to a conversation that my husband had with one of his friends. The friend said that one of his friends had the actual virus and they were talking on the phone. And he said, well, where are you, friend? And the friend said, well, I'm at the barbershop getting a haircut. He actively had the virus. So can we talk about people being outside of the bubble and what they should do?
Yeah, so that situation, unfortunately, is all too common. And I've had other people tell me that on the phone as well. People have called to tell them they tested positive and they're out at a grocery store, and that's pretty frustrating. So again, I think that if you are around someone who had coronavirus or if you have any symptoms, of any kind of respiratory infection, even if you don't think it's coronavirus, I would say be better safe than sorry. Limit your contact with others. Don't be doing those things to protect other people, because you never know, even if you have a mild case, if they're going to get very sick. And if you are trying to see small groups of people, trying to make a bubble, really ask people before you see them what they really have been doing. Get kind of concrete answers like that, not just, oh, I've been being safe, but really, in the last week, where have you really gone? Who have you really seen? Make people commit to an answer there. And then if they say things like that, oh, I went to the barber shop, I went to all these places, I saw my relative in Virginia, or whatever, maybe not see them, because you don't know really what their risk is and what that risk might mean for you.
Okay. So I talked about how I got a chance to meet you. So I had to come to the clinic at Lincoln to get a COVID test.
Mm-hmm.
Will you explain what happens when a person is tested for coronavirus?
Sure. So the way we test here and where most places test, it's a nasal swab. So you come in, and usually through the window of your car, a person will come out and stick this cotton swab pretty far back into your nose, because it wants to get not just the front part of the nose, but back into the sinuses, where the virus replicates and grows. So they swab that around to disturb the cells, get some viral particles, hopefully, and then they send that to the lab in a preserving solution, where it's tested for the actual virus itself.
So I want to let everybody know that me and my husband tested negative. So that was a celebration moment.
Mm-hmm.
During the time when when we were at the testing facility, my husband, he was a champ. He didn't flinch. He was following directions very well. But it came time for me to have the swab up my nose. I was not as calm. And I would let you know that there was a lot of squealing involved, but it was very much necessary. And that was my first test. So I just want to assure everybody that you won't die from it. That it's something that's really very necessary for you to be able to get an accurate sample to make sure that you know your status, whether or not you have the disease. So I just wanted to add that, and I'm still a little bit traumatized, but on, doctor, life goes on.
Yeah. Well, I've actually, as part of working here, certainly we've had a lot of patients we've been seeing here at Lincoln, and I've been tested myself 5 times. It does not get much better doing it again, but it is a necessary evil to put up with, that discomfort and kind of the watering eyes and that feeling in your brain to know. There are some tests that came out a little bit later through all this where you do the swab yourself just in the front of your nose. Those are also pretty accurate. We don't do them here, so I'm not as familiar with them, but that is one option people might see going to somewhere like CVS or any of the local pharmacies that are doing testing. That's what they usually do.
So what about testing at home? How accurate can those tests be, or not so accurate?
So there's, I think, one home test now that is either close to being approved or was approved. I'm not sure. From what I understand, what they were looking at, it looks like that should be pretty accurate and faster than some of these other tests, but I don't know firsthand how that has worked out. It's not something we've been able to get here at Lincoln to give to patients, so I'm not sure. I would say that we have seen many cases where people have done a self-swab at a pharmacy, or even had a test here that's been negative. They've continued to have symptoms, or they've still had a very concerning exposure. We've then tested them a second time or a third time, and eventually it is positive. So all of these tests have a false negative rate where they can be wrong. And that's anywhere, depending on what set of data people look at, from 10 to 30%, which is significant. So we feel good about negative tests, but depending on the situation, it doesn't mean you're 100% in the clear.
So if I'm infected and I don't have any symptoms, can I still spread the virus?
Absolutely, yes. That's actually a big problem with this virus, where people start spreading it before they get symptoms, so before they know they have it. And then some of those asymptomatic people that never feel any symptoms still are spreading it. And that's really why it's been able to spread so far, so wide, and it's been so hard to control because of that.
All right. So with the virus, the seriousness of the disease, like with age and like maybe other maladies that you might have. Could you talk about those situations with people that you see who have other conditions and still are faced with COVID?
Yeah. So age is a big one. Usually because as people get older, they have other chronic medical problems. So big things that increase risk are, kinds of lung disease. So people who have COPD or emphysema, things like that, where they can get much sicker from this, which makes sense because primarily is a disease that affects the lungs. People with diabetes or any other chronic disease that lowers their immune system a little bit, which diabetes does a little bit, or certainly people with cancers or undergoing treatment for cancer where the medicines they're giving knock out their immune system. Those are usually the most common ones. There's a risk of people getting sicker from things like heart disease or heart failure, really because those diseases tend to flare and get worse anytime they're sick from something else. So it's not maybe a direct effect, but just because they're sick from one thing, you've added a second thing and their body can't deal with both at the same time. And so a lot of those people we've seen get hospitalized and sometimes for a long time before they're able to recover, and unfortunately some don't.
So can you tell me, when you get the test results, what do the test results actually mean?
Yeah. So it depends on the situation, to be honest with you. So for example, in your case, exposed to someone with coronavirus about a week ago, but has had no symptoms during that time. So we say that usually the amount of virus in your nose where we test is high enough where we can really detect it reliably in the 4 to 6 day range. So with your negative test and no symptoms after a week, I feel pretty good saying that you did not contract it, and so you'd be safe to end quarantine and go about the world. For someone who was exposed 1 day ago or 2 days ago who has no symptoms and is being tested, I don't trust that result at all, because it still is very possible that in another 2, 3, 4 days, you'll start having symptoms. And if we retested you, it would be positive. We've seen that a lot. For people who have kind of mild respiratory symptoms with no exposure, maybe have allergies, have asthma, have another reason why they might be having respiratory symptoms, I tend to believe the negative test when I have something else I can blame for what they're experiencing. But again, if they were just around someone with COVID, they don't have any other reason why they'd have these symptoms, and they have symptoms that are consistent, I don't necessarily trust that negative test and still recommend people quarantine until their symptoms are gone. And if things worsen, we test them again. Yeah, it depends.
So I want to ask you too about the actual virus vaccine. Are you hearing any word about when the vaccine would be available at Lincoln, or is it already available, or how is the rollout going in your perspective?
Yeah, so I've gotten the first dose of the vaccine myself. We're going to have the Moderna vaccine here at Lincoln. We don't have the deep freezers that the Pfizer vaccine needs, which a lot of clinics don't. So I got the first dose of the Moderna vaccine, actually the health department. I'll get my second dose here later this month, and that's what a lot of staff are doing. We are very soon going to be able to offer it to patients. I don't know exactly when yet. That's being worked out. We're working on getting staff vaccinated first. And we are following the North Carolina guidance on this, where the first group after healthcare workers is going to be people over 75, which Duke has actually started doing already with I think mainly the Pfizer vaccine there, but they're offering it to everyone over 75 in their system. And then after that, the next group would be people with significant medical comorbidities, like we talked about, who are at higher risk, and essential workers in that group as well, people who need to be out in a grocery store, out doing deliveries, out where they're around people. And then at some point after all of that, then it would just be for the general population, anyone who wants a test. So that first group, that's 75 and older, I think has started already in this area, and will start here at Lincoln very soon. When these other groups all get started, I really don't know. I'm not sure, and don't think we have a good sense of how many people in our system or Duke system are over 75. And so I don't know how many doses they need to cover that group before we move on to the next people. And it all depends on how much vaccine is given to each state, to each county, to each clinic, which is way above my pay grade.
Well, thank you for using your pay grade today to talk to us. That's all the time that we have. So Dr. Joseph Plaksin, thank you so much for spending time with us here on COVID Conversations today.
Of course, thanks. It's been great talking with you.
And thank you, audience, for watching Zoom and for listening on WNCU 90.7 FM. I'm Kimberley Pierce Cartwright, your host for COVID Conversations. Until next time.